healthy dose of information from Hannibal Regional Hospital and Hannibal Regional Medical Group. Today we're talking about cardiovascular disease, and joining us here in Studio H is nurse practitioner Kim Bernard. She's with the Hannibal Regional Medical Group Cardiology Department. Good morning, Kim.
Good morning.
How are you doing?
I'm doing well this morning.
Good. Thanks for coming in to join us this morning and talk a little bit about cardiovascular disease. What is it?
Cardiovascular disease is a broad term for any disease that affects either the heart and or the blood vessels. It is also the number one cause of death in both men and women in the United States.
So as a person, just as a common person, you're going to know this probably as a heart issue?
Correct.
Okay. And that's something that, of course, we want to pay a lot of attention to.
Absolutely.
And we need to take a lot of steps toward making sure that we're in the right position with being healthy. What are the risk factors for developing cardiovascular disease?
There are several risk factors for developing cardiovascular disease. Some of those are modifiable risk factors, meaning you can change and modify behaviors and lifestyle and reduce those risks. Those include smoking, diet, so decreasing fat intake, and eating a healthy diet with lots of fruits, vegetables, lean meats, and the good fats. And there are other things that are not modifiable, such as age. We can't change our age, and we can't change who our parents are. So there's some genetics that play a part in it as well. So those are the main things, preventing high blood pressure and diabetes. Those are other risk factors as well.
And those will do with diet and exercise. And I would say, too, I find that you probably do a lot, that a lot of it's a person's attitude, too, in life. If they're a person that's positive and happy and pretty much healthy, they seem to just do much better with not dealing with these types of issues as much. Isn't that true?
Absolutely. Absolutely.
But it could be a situation, too, where it's a family issue. It's hereditary. And the thing at that time is to make sure you're having the conversations with your family, especially during holidays and different family events and things like that, talking to family members and finding out what is being passed through in the family, what things you need to look out for, right?
That is correct.
Yeah, and it's interesting, too, I think, because even with if your family history is like that, if that's there, I mean, does that make it that much more important for somebody to do these things that you talked about? I mean, the risks got to go higher if you've got that family history and you smoke and you have a terrible diet. I mean, do you think the family history factor, makes it even that much more important to take some of these things into consideration?
It really does. The coronary artery disease is the most common type of cardiovascular disease. That includes heart attack, the plaques caused by the plaque in the arteries. And then it's also includes ischemic heart disease when the heart isn't getting enough oxygen to meet the supply of the body. But coronary artery disease can cause heart attack. And if you have a relative, a man in your family that's had a heart attack before the age of 55, or a female primary, either your parents or a sibling, a female before the age of 65, that puts you at even higher risk for coronary artery disease and cardiovascular disease in general.
Yeah, things that you really need to watch out for. What are the symptoms? Because the symptoms can vary from a man to a woman, too, as to how they feel a cardiovascular situation coming on, right?
That is true. The classic signs of a heart attack are chest pain, and it's usually a tight squeezing pressure type pain. It can radiate to the jaw, left arm, jaw, neck, or back. And then sometimes it's associated with shortness of breath or sweating, possibly nausea. A lot of times diabetics, because of the neuropathy, they don't experience any of the chest pain symptoms. Sometimes
Really?
It could be just fatigue or shortness of breath. The elderly person may present with confusion or, just shortness of breath or fatigue. Women, especially young women, don't present with those classic symptoms either. So.
Because it can even be back pain or something for a woman, right?
Right. It can present atypically, which is, a different type of pain or symptom. So.
How do you encourage people, and now would be the time to encourage people to get some assistance? Because I imagine it's pretty frustrating when you get a guy there and you say, how long have you been having these symptoms, thinking that they just rush to the hospital. And he goes, well, it's been going on for a week or two.
And I think the delay is common. I think a lot of times it's either an insurance issue, a financial issue, a denial issue, or women tend to be the worst about, when they're taking care of other people, taking care of themselves. So a lot of times when patients have, or people have these symptoms, they often put off going to the emergency room, and time is of essence as far as heart damage is concerned, and same with stroke.
Absolutely. So, yeah, it's a big deal. I mean, it's very important that you get this taken care of. And the thing is, a lot of times anymore, a person will go in, they'll have a procedure, and they end up feeling tons better, and something could have been done about it.
That's correct.
So the one thing I was going to ask about the symptoms too is with these, can you get these symptoms and maybe it's just a sign that you're getting to that point? Or, I mean, do you get these symptoms and you're about to have a heart attack right then that day, or you can have these symptoms and it's just telling you that this could be coming? I mean, could it be even further after, one day?
Yes.
You know what I mean? Like, so it's not like the symptoms you get them, it's not like it's automatically immediate. It could be a buildup or whatever it may be.
That is correct.
Well, that's interesting.
That sometimes happens, and other times it's, a massive heart attack can occur all at once,
right.
Or sometimes you do get warning signs with chest pain or shortness of breath with exertion, and usually the symptoms come on with exertion or emotional stress, and typically kind of subside when you rest, and that's classic signs.
Kim, what can be done to prevent or slow the progression of cardiovascular disease?
I think it's very, very important that no matter what age you are, you get in to see a primary care physician and get those screenings done. Screenings are very important. High blood pressure is really a silent disease, and it can cause target organ damage, including the heart. So it can cause the heart muscle to enlarge, which in the long run can cause pump function with the heart and can cause heart failure. So high blood pressure, getting that under control is a big ordeal. I mean, you need to have your blood pressure checked just to see where you are with that. Cholesterol, that needs to be checked as well. That's a great screening. And the HbA1c to check for diabetes, because those are all huge risk factors for the development of cardiovascular disease.
At what age should you start looking into this?
That really depends on definitely your family history, your other medical problems and that, but it's good to get in to see, even at an early age, to see a primary care physician. We're seeing more diabetes in teens and children even. So it's really good to get those screenings in and get an annual check with your primary care physician, no matter what age you are.
And you can do that with Hannibal Regional Medical Group, Hannibal Regional Hospital. There are resources available to learn more about cardiovascular disease and ways to stay healthy. What are those?
The American Heart Association is a great resource for patient education or education of the general public on what heart disease is and what you can do to prevent heart disease and what you can do to manage. As far as there's a lot of good healthy eating and diet recommendations. And the American Heart Association also recommends that everyone exercise 30 minutes a day, 7 days a week if possible, but at least 5 days a week.
Right.
And moderate activity. So for some people that may be walking. For people that are a little more athletic, that might be jogging or doing something that's a little more strenuous. So
but
that's
whatever age you are, you need to be active. You need to be exercising.
Absolutely. It decreases your blood pressure. It decreases your stress level, helps with depression, and just a load of other things. So it's really a good habit to get into. And I know the issue with a lot of people is finding a time, and you just really need to prioritize that because it really is a great thing to do for your health.
Are you doing it?
Yes.
Might as well ask.
Said it so seriously. No, but it's interesting too about this too. It's the number one killer of people, but at the same time, there's pretty good guidelines laid out on how not to have this happen to you or to really reduce your chances. That's not the case with everything medically that that people suffer from. So the information's out there too. You know what I mean? It's some of this is on people to kind of look in the mirror and say, I want to live a healthy lifestyle. Hannibal Regional, they've got pretty nice facilities for this kind of thing over there too, right?
That is correct. And the website is hrhonline.org or hannibalregionalmedicalgroup.org.
Okay, get more information there, and you might give them a call. The number, all the information is there. If you'd like to set up an appointment, check in with them and find out, because this is something you definitely need to take care of. Cardiovascular disease. Kim Bernard, thanks for coming in. We appreciate it.
Thank you very much.
Kim is a nurse practitioner at Hannibal Regional Medical Group Cardiology Department, right here on News Talk Live. Again, their website is hrhonline.org. That's your healthy dose of information from Hannibal Regional Hospital.